Cities and towns across Oklahoma understand the importance of unity.
The Muskogee Nation, ever since the 1970s, has led tribal health care when it came to providing care for an entire community. We took over the first community hospital in Okemah that really took care of anyone that came to the hospital. So we had an emergency room that was open to the community. We admitted patients to the hospital beds in that community. We've been doing this ever since the 1970s. These rural hospitals are dying right and left, and they have been for the last several years. We've also made major investments in Eufaula, where we did a joint venture with the Indian Health Service, where the tribe invested in a $30 million healthcare facility. We invested in a $55 million facility in Okemah to replace a critical access hospital.
I'm not sure anyone in healthcare realized, what this last year was going to be like. There have been pandemic scares periodically. When this one started, I don't think anyone could foresee that it was going to be as bad as it has become. And it has been a year that had a lot of highs, but a lot of lows too. A lot of ups and downs in our work effort and people's emotions and things like that. It's been one of the years that I think everyone in healthcare, everyone in America, everyone in the world will remember.
I look at this situation, the COVID-19 pandemic, as the refiner's fire. And I think we've been refined and hardened and sharpened, and the Citizen Potawatomi Nation Health Services has actually grown and expanded services during the pandemic.
We partnered with the Oklahoma State Department of Health. We reached out to them to say, hey, how can we help provide vaccines throughout Southeast Oklahoma, and not necessarily even Southeast Oklahoma residents, but events in Southeast Oklahoma, because we'll provide it to anybody that walks through the door.
Well, it makes me feel very proud that we can be a force for good in so many areas, but what better place to be a force for good than getting the vaccines out to people? We have our health system that we've opened our doors to all citizens. We're all in it together. And when it comes to the vaccine, we really are all in it together.
You'll hear a lot of tribal leaders say, we think about it in terms of 7 generations into the future. The decisions that we make today are going to impact our kids and our tribe well into the future, so always keep that future-oriented look toward the decisions that you make. And that's what we did during this pandemic. When you get down to healthcare, as an example, for one of the departments that we run, tribes have long had public health programs, and public health programs were what has helped us a lot during this pandemic.
Without the Choctaw Nation, we could not save as many lives as we do. During the pandemic in 2020, the Choctaw Nation hosted 28 blood drives. 5,600 lives were saved in 2020 just from Choctaw Nation blood drives. With the Choctaw Nation, the number of donors that we see every 56 days, whether it be at headquarters or in other areas of the nation service area, there's no way we could continue to save that many lives.
The tribes have been phenomenal partners, and as they have always been phenomenal partners with us, I think they've always had the foresight to see public health-wise where they need to be and where public health needs to be, not only for the nation and its citizens, but also for the community at large. I always feel like, irrespective of what we've been doing with Choctaw Nation, whether it's been responding and assuring that flu shots are available, it's always been, how does the nation improve community health, irrespective of tribal citizenship? They're seeing needs and filling those, where some communities and some cities don't have the financial ability to do that, and it's benefited and grown our communities.
Well, what I can tell you, as far as from the perspective of a medical administrative leader of the Citizen Potawatomi Nation Health Services, is that we've been a collaborative partner with the state the whole time.
Our mission, actually, in our health system is to better the community, not just tribal members in our area. It's to better the community.
And I think it's an example of why Oklahoma is such a special place. We have the state of Oklahoma, we have the counties, we have the cities, and we have these great tribal nations. And I think that makes us unique and really head and shoulders above other states in the country, because we have all these resources.
Oklahoma thrives together.